It is my pleasure that I have today the honor to speak about the history of the Department of Cytopathology at the Institute of Oncology in Ljubljana, where I have been working for more than 40 years. This is the second time in 20 years that I have been given this role. And as the Slovenian saying goes, v tretje gre rado, or in English, third time's the charm, you just might see me in this role again in 10 years' time. As most of you probably already know by now, cytopathology was introduced at the Institute of Oncology Ljubljana in 1951 by Professor Božena Ravnichar and was applied to routine practice a year later when the first 224 samples of exfoliative cytology have been recorded, including mostly cervical smears, effusions and sputum. Professor Ravnichar was not a pathologist. However, she was a pioneer in oncology who during the early 50s was acting as the scientific director of the institute, as manager of the cancer registry, and as the only doctor in the histology laboratory, as it was called at that time. She learned about cytology during a visit to the United States and was examining cytological samples by herself for the first 3 years. The first location of cytology laboratory was in the attic of the old military facility of Šempeter and later on the ground floor of the same building. The facilities were entirely unsuitable and we awaited for new premises till 1986. Professor Ravnichar was aware that cytology will not flourish until new people could be hired who would devote all their time to only one specialty. So, Dr. Maria Us, later Professor Us Kraševec, was hired and became the first head of the cytology laboratory in 1959, which staffed only 4 people. The cytology laboratory later expanded into the Department of Cytopathology, and Professor Us remained its head for 33 years. At the beginning, she expanded the exfoliative cytology by including urinary samples, cerebrospinal fluids, breast discharges, scrapings of skin lesions, and bronchial lavage samples into cytological examination. Most importantly, in the same year when she started working at the Institute, she introduced a new diagnostic tool, the fine needle aspiration biopsy, on the suggestion of Dr. Berta Jareb, a clinician who learned about this method in Karolinska Hospital in Stockholm, Sweden. Until the second part of the 80s, non-palpable, deep-seated lesions were not accessible to cytology. It was not until 1987 that we were able to examine the first ultrasound-guided FNAs. Since many samples were unsatisfactory at the beginning, this prompted the introduction of rapid on-site evaluation of FNA samples in order to improve the yield. We started using it in our FNA clinic first and later also for ultrasound-guided samples. Almost at the same time, in the middle of the 80s, it became apparent that microscopic evaluation of cytology samples and old ancillary techniques would not be enough for accurate cytopathological diagnostics. Therefore, in 1986, manual immunocytochemical staining was implemented in our daily practice, which is still the most important ancillary technique in cytopathology as well as in histopathology. The second important ancillary technique was flow cytometry for measurement of DNA quantity in tumors, which was introduced in 1988. The flow cytometer was first used mainly in research projects. Later, measurements of DNA ploidy and proliferative activity were also used for detecting early recurrent disease of urothelial cancer for bladder washings and as prognostic marker of breast cancer. One of the very important contributions of Professor Us to successful operation of our department was building the database of cytological samples and reports already in the late 60s. In the middle of the 80s, when we obtained our own computer, she helped to develop the first program for registering patients' personal data, type of cytology material, tumor location and diagnosis. In 1994, the program was upgraded to enable saving the whole cytological report in electronic form. However, it is not suitable for today's needs anymore, and we are eagerly awaiting modern laboratory information system, which hopefully will be implemented by the end of this year. For her contribution in the field of cytopathology, Professor Uskraševec received the IAC Maurice Goldblatt Cytology Award in 2005, which was presented to her at the International Cytology Congress in Canada in 2007. 5 years before her retirement, Professor Us decided to hand up the leadership of the department to a younger colleague. In 1992, she proposed that Dr. Anna Pogačnik takes over. Professor Us remained with us for many more years, helping with the implementation of new ancillary techniques, research work, education of future cytopathologists, and informatization. By the end of the 80s, a lot of new knowledge had been accumulated in the field of lymphoma. Therefore, our diagnostics of lymphoma no longer met the demands of our clinicians despite the use of immunocytochemistry. It became inevitable to buy a new tool, the flow cytometer for immunophenotypization, which happened in 1998. From then on, flow cytometer became an indispensable tool in our diagnostics of lymphoma and leukemia, and is today one of the most important activities of our department. The year 2002 marked a new period in immunocytochemical staining because we switched from manual to automatic immunostainer. In order to improve our results, we also joined the External Quality Control Scheme for Immunocytochemical Staining, the United Kingdom NEQUAS. During the 90s, the incidence of cervical cancer in Slovenia was steadily increasing due to opportunistic screening. Dr. Pogačnik and Professor Us were both actively involved in the preparations of the organized National Cervical Cancer Screening Program ZORA, which started in 2003. Our department is nowadays still involved in cervical screening for the needs of this program. 17 years after our department moved to the new facilities in Building D, it was again time for reconstruction. The works started in 2003 and lasted 2 years. Our department operated in the middle of the construction site in dust, noise and cold during winter, since central heating was disconnected many times. Dr. Pogačnik played a valuable role in planning the layout of the laboratory and in the selection of new equipment. Unfortunately, she was not able to be present at the opening of the new premises. At the very beginning of 2005, Dr. Pogačnik joined her husband, who was working abroad at that time, and so she temporarily left the institute a couple of months before our department was due to move to the new location. So I became the new head of the department. It was a bit of a challenge being new at the job as the department's head and overseeing the last part of the reconstruction with the transfer to the new location, since I was previously not so actively involved with the renovation. In 2005, the ZORA program had been in operation for 2 years. By that time, it was apparent that teaching of cervical screening had to be centralized. Therefore, the Ministry of Health of Slovenia authorized our department to organize the school for screeners in the form of 6-month courses, which would be run on a regular basis. The school's curriculum was modeled after one used in British Columbia in Canada. Professor Margareta Strojan-Frežar, who worked in our department at the time, was appointed the head of the school program. She was later succeeded by Dr. Pogačnik. In 2009, the Department of Cytopathology received an operational license issued by the Ministry of Health after we have successfully passed the external quality control audit. The preparations for the audit lasted several years and included the personnel of the whole department. In 2010, the National Cervical Cancer Screening Program introduced the HPV triage test. Only 2 laboratories were authorized to perform the hybrid capture 2 test for ZORA program. There was a lot of opposition and serious doubts that our laboratory can perform this molecular test reliably. However, we were able to implement the method successfully in 2012, and we are still obtaining accurate results. At the end of my talk, I would like to apologize for not being able to include the work and achievements of many doctors, technicians, and other professionals who in the past have contributed immensely to the successful operation and growth of our department. The time slot also did not permit me to mention our research work or other professional activities in which the workers of our department have been involved, like the Society for Cytopathology or the organization of 2 European Congresses of Cytology that we hosted in Ljubljana. Maybe more next time. Thank you.